In this video, I'm going to be explaining a little bit about handpieces, how to put the burrs in them, and what they do and who can use them. So this here is our high-speed handpiece. So as you can see here, this is where we are going to insert the burr. There is a push button on the back. You have to kind of use a lot of force to be able to get your burr in, but this is going to be used in any type of restoration where they'll need to cut, trim, or remove part of a tooth. So for our burr block here, I'm going to pick one up. This is our football burr. As you can see, it kind of looks like a football. There are many different kinds of burrs. The ones you will use will be based on your procedure as well as your dentist preference. So to insert this burr, obviously the piece that has the gridded marks, that is what's actually going to be used to help remove part of that tooth. This flat end is what is going to be inserted inside of our high-speed handpiece. Once again, in order to insert this, I need to put a lot of pressure on this button on the back. Once I have it pushed firmly, I will go ahead and insert the back of the burr and let go of the button on the back. You always want to make sure that you are testing if the burr is put in the handpiece properly. If you pull it forward, it should not come out. If you do not have it inserted properly, when you go to pull it, it will come all the way out. So you always want to make sure before your dentist sits down that you have it fully inserted into your high-speed handpiece for your dentist to use. Once you have your burr inside of your handpiece, you're going to want to attach it to your dental unit. So what you do is you are going to grab one of these and you are going to line up the bottom. As you can see, there are similar holes. So all you're going to do is line and match up the holes. Push this forward, righty-tighty, and it will tighten and fit your high-speed handpiece into your dental unit. Now, to make sure that this is actually going to work for a procedure, you will want to make sure that you push on the rheostat, which is the foot pedal that makes the dental unit run, to make sure that this is spinning and has water coming out of it. Because as we know, we need water to come out of our high-speed handpiece to help cool the tooth from the friction that the burr causes by how fast it's spinning. This here is our slow speed motor. So unlike the high speed handpiece, you have a motor for your slow speed and then attachments that you will put on to create your slow speed handpiece. So these are two examples of the types of attachments that can go onto your slow speed motor. This here is your straight attachment. You will just place this on by, once again, this projects out. This has a hole. You will hear it snap and lock in, and this will make your straight attachment and your slow speed handpiece. To take it off, pull it off. Same thing, this is called our contra angle attachment. For our contra angle attachment, it is the same thing. The projection goes inside of here. You will hear it snap, and that's how you know you have it assembled properly. With our contra angle attachment, it has a latching mechanism on the back. You insert your burr from the front and you will secure your burr in the back by latching it closed. So in order to insert my burr, first I need to make sure that my latch mechanism is open. I'm going to grab my burr. You can tell with this type of burr, there is a kind of a latch that you can see where it would hook onto. So this is the back of my burr. This is the front of my burr. This is called a round latch back. So how to insert this is, once again, my latch is open. I'm going to place the back of the burr inside here and I flip it around, and you will want to focus in on where this big hole's at because you will need to twist your burr into the correct position. Once you see that it's all the way to the back of that circle, you will then be able to close your latch. Once again, pull on it to test that to make sure it's secured. And if it's not secured, this will be able to close, but your burr will come out. So once again, make sure it's open, put it in through the front. You will have to spin it. Once you find it in the back, lock it and secure it. For our straight attachment, there is a different type of burr we're going to use. So this one here is an acrylic burr. This is going to be used to work on things such as temporaries, dentures, partials outside of the mouth. So with this acrylic burr, this is the front of it, this is the back of it. The back is going to go in the center here. And then there are two little graded parts where you're gonna put your fingers at. One, this top one, I'm gonna turn to the right. This bottom one, I'm going to turn to the left, which is going to lock my burr into this handpiece, and you will hear it click. Once it's locked, once again, you will pull up, make sure that it is secured. If it is not secured, when you go to pull it out, it will come out. So you wanna make sure that it's locked in. Once again, to take it out, twist it the opposite way to pull your burr out. Similar to our high-speed handpiece, to attach this to our dental unit, we are going to make sure that the circles line up. Push this up and twist it on. Once again, you will push your rheostat, which runs the foot pedal that runs the dental unit, to make sure that this is spinning and is working good. This here is our Hygiene handpiece. Your hygienist, or depending on what state you're in, assistant will be able to use this to polish or pumice teeth. So this attachment, you will have a prophy cup. This one is disposable. You will line up the hole that's in the prophy cup with the projection, and you will see that there's this little button here, and you can see that there's a hole for the button. Once again, go ahead and line it up. You will push it down, and that is how you are going to assemble your Hygiene handpiece. This part here toggles, so that way instead of moving your wrist so much, you can just twist your fingers to adjust where this goes. To assemble our Hygiene handpiece to our dental unit, this one you can see doesn't have as many holes as this. That is fine. It is still just going to line up. Big hole with the big hole, small hole with the small hole. Twist and pull it up. And once again, push on your rheostat to make sure that this will run.